Parenteral formulations are lifesavers in emergency situations. One such emergency situation is status epilepticus. Levetiracetam is one such drug that is parenterally administered in such type of epilepsy during emergency. How does levetiracetam work? During a seizure, electrical signals in the brain cause the release of chemicals called neurotransmitters. These neurotransmitters help to send messages between nerve cells known as neurons. If the release of neurotransmitters happens too often or goes on for too long, there may be an overload in these electrical signals. This overload can result in a seizure. Within the neurons, levetiracetam attaches itself to specific molecules called synaptic vesicle protein 2A or SV2A. These molecules are found on the surfaces of tiny structures in the neurons called vesicles. The attachment of levetiracetam to the SV2A molecules helps reduce the abnormal spread of signals and eventually halt seizure. This levetiracetam parenteral injection before administration is generally diluted in 100 ml of an appropriate diluent such as normal saline. There are several limitations with the existing formulations used parenterally, and these include need for dilution prior to administration, multiple injections in the loading dose, only one strength being available, greater preparation time, probability of occurrence of errors during reconstitution, enhanced risk of handling and thereby contamination, greater chances of wastage of product while dilution. These are cumbersome in terms of handling, storage, reconstitution as well as administration. Oftentimes, there are errors associated with the reconstitution of medications, especially injectable formulations. A simulation study demonstrated that the mean rate of such preparation errors is 6.5%. These errors can be classified as dilution errors, accounting for 50% of such errors, selection errors accounting for 28% of such errors, and quantitative errors accounting for 20% of such errors. Innovations can be lifesaver in epilepsy patients. Several little innovations in the field of medicine have touched the lives of hundreds and thousands of patients and have gone a long way in improving their health. There is a strong need for innovations in the area of emergency medicine in epilepsy. Introducing, for the first time in India, Levera RTU, ready-to-use levetiracetam injection. The most convenient ready-to-use formulation. Levera RTU is an innovative IV solution in the form of a ready-to-use levetiracetam injection. Levera RTU is rapid in preparation, trustworthy in accuracy and dosing, unmatched in saving time. Levera RTU can be used in the management of status epilepticus, seizures due to traumatic brain injuries, perioperative seizure prophylaxis, Let us look at the unique features of this preparation. Livera RTU is rapid in preparation, pre-mixed and ready to administer. No dilution required. Pre-labeled, color-coded doses available in 3 strengths. Livera RTU is trustworthy in accuracy and dosing. Minimizes medication errors with 100% dose accuracy. Reduces the risk of contamination. Provides better infection control. Livera RTU is unmatched in saving time. Reduces 32% nursing time in preparation. Reduces overall cost burden to patients. Reduces waste materials. Another unique feature of this formulation is its packaging. It conforms to the SCT protocol of Steriport packaging. S. Sterility. Sterilized at 121 degrees Celsius, therefore a higher sterility assurance level. C. Closure system. Dual port closure system with an additional port for supplemental medications. Additional protective barrier to ensure zero leaching. Plug is made of latex-free rubber. T. Transparency. Transparent packaging for better visual inspection. How to administer Livera RTU. Livera RTU should be administered as a 15-minute IV infusion via single-use 100 ml dual port bottles. The strengths available are Livera RTU 500 mg, Livera RTU 1000 mg, Livera RTU 1500 mg. Starting dose 1000 mg per day, given as 500 mg twice daily. Dose increase every 2 weeks by 1000 mg per day as needed and tolerated to the recommended dose of 3000 mg per day. For adult patients with impaired renal function, dosing must be individualized according to patient's renal function status. Patients must be advised to notify their physician if they are pregnant prior to therapy. Store at 20 degrees Celsius to 25 degrees Celsius. Physically compatible and chemically stable for at least 24 hours when mixed with lorazepam, diazepam and valproate sodium and stored at control room temperature 15 degrees Celsius to 30 degrees Celsius. Shelf life is 24 months. In summary, innovative product, pre-mixed and ready to administer, no dilution required, administered as a 15-minute IV infusion, pre-labeled, color-coded doses available in 3 strengths, single-use 100 ml dual port pack. Formulation is approved by the US FDA and DCGI. Reduced chances of error. 32% reduction in nursing time associated with preparation and administration. Assist in the ease, accuracy and convenience of dosing. Gear up and get ready to use the new ready-to-use Livera RTU.